Hello. You ready?
Yeah.
All right, follow me.
COVID-19 has really caused many different challenges, whether that's with reducing exposure to people who have COVID-19 or trying to reduce the amount of, say, a PPE that is being consumed, or just even needing to bring the clinical workforce into the hospital. So with these telepresence robots, we are able to provide solutions to some of these challenges.
Hey guys.
Hi, Jill.
Ashley, what's going on, you guys?
Not so much. How about
So
you?
at first impression, when you see Jammer operating in the hospital, it surprises you. There is this set of wheels with a device on the top of it with somebody's head, and it's rolling and navigating itself around the unit. And the individual driving it is able to see everybody, talk to you by name, so it surprises you.
Is there anyone behind me, Ellie?
Nope, keep going.
So using the jammer has been a great experience for me and for the staff, and I think for the patients. I am able to participate in rounds, I'm able to talk with the nurses at the bedside, and I'm also able to visually see my patients. And I think it makes them giggle, and they are able to kind of have a little levity to their day and bring them a little joy. Especially for my COVID families, like the one or two people who have been truly isolated, I think it's amazing for them to be able to see someone, to talk to someone, to, again, bring some joy into the room. This is a new world we're living in, so I don't know how we're going to adjust. I mean, obviously, human connection is so important, but this has been giving us that when we didn't have it even just a couple weeks ago.